tube dysfunction by Dr. Brunworth.
In today's literature, it remains controversial whether gastric reflux reaching the nasopharynx can contribute to sinonasal and otologic diseases. Limited human research has been done to evaluate the potential effects of low pH near the eustachian tube orifice. In pediatrics, studies have shown that reflux affects eustachian tubes and can lead to an increased risk of otitis media, as illustrated in 2004 by Issing et al. Other studies have shown histologic changes in animal eustachian tube mucosa after exposure to gastric reflux. Recent advances in pH probe technology has allowed monitoring of pH in a non-liquid environment. The standard pH probes were found to have inaccurate readings when taken out of the esophagus and placed into the posterior nasopharynx or even oropharynx. The probe used in this study, which measures pH in an aerosolized environment, allows researchers and clinicians to successfully determine whether gastric reflux has reached the nasal and allows correlation with patient symptoms. The aim of this study was to record pH values near the eustachian tube orifice of patients that suffer from eustachian tube dysfunction and compare them to the pH of patients without the disease. To ascertain this data, a pH probe designed for a moist but non-liquid environment was placed at the eustachian tube orifice of several control patients and subjects with eustachian tube dysfunction. Between November of 2009 and February of 2011, patients with and without eustachian tube dysfunction were enrolled in the study. After informed consent and a small questionnaire was completed, patients had a DX pH measurement system probe made by Restech Corp in San Diego placed near the torus tubarius in the posterior nasopharynx. The placement was confirmed using a flexible fiber optic laryngoscope and then secured to the patient's cheek. Once in place, the single-channel pH probe takes a reading every half a second and sends the data wirelessly from the attached transmitter to a DX recorder. This is worn around their waist or around their neck. Throughout the 24-hour study, the patient records clinically relevant information, such as meals and symptoms, with the push of a button, as well as manually into a written diary. Upon completion of the study, the pH data and patient information is downloaded from an SD memory card into the DX pH data software to be viewed, graphed, and analyzed. This graph shows the variation of pH throughout this patient's 24-hour study. The areas where there is no data collected, which is right here, here, and here, is while the patient is eating, and these are excluded. Reflux events were defined as pH levels less than 5.5 while upright, and pH less than 5.0 while in the supine position. The lavender shaded area represents a pH of 5.5, and the purple line represents a pH of 5.0. That's while they were sleeping. This particular patient did not have any significant reflux events that reached below those points. A total of 38 patients completed the single-channel pH probe study. 17 patients with ETD and 21 control subjects had a probe placed near the torus tubarius in the posterior nasopharynx for 24 hours. There were 20 males and 18 females. The average age was 37, ranging from 19 to 76. The average pH value obtained from the nasopharynx of adults with no history of eustachian tube dysfunction was 7.03. In comparison, the average pH for patients with eustachian tube dysfunction was 6.90. This p-value for the difference was 0.48. Although not significant, a trend was noted for patients with eustachian tube dysfunction to have lower pH and more reflux events when compared to patients without eustachian tube dysfunction. The pH ranged from 5.33 all the way to 8.06, and this table shows the average pH values for the various groups. The average pH was found to be 6.9 in patients with a history of eustachian tube dysfunction. The average pH for all 21 subjects without symptoms of eustachian tube dysfunction or gastric reflux is shown in the middle at 7.03. The average pH for the group of patients who had eustachian tube dysfunction and a history of reflux was 6.7. The average number of nasopharyngeal reflux events for subjects was 0.55 events over a 24-hour period for controls and 2.1 for patients with eustachian tube dysfunction. This could suggest that although the average pH for patients was insignificant in comparing the two groups, however, there was a significant difference in the number of events, which could mean that eustachian tube dysfunction patients are having more reflux events and thus more exposure to gastric acids over time. Unfortunately, several pitfalls existed for our study. Primarily, there were not enough participants to create a powerful statistical analysis. Secondly, the patients with eustachian tube dysfunction that suffered from reflux were more likely to volunteer to have a pH probe done once it was explained to them, compared to the patients with eustachian tube dysfunction that do not have reflux. Lastly, if higher numbers were obtained, it would be more feasible to categorize the patients into groups with eustachian tube dysfunction and a history of reflux symptoms, ETD without a history of reflux, control patients with reflux but no ETD, and control patients without reflux symptoms. The future application of measuring pH to detect nasopharyngeal reflux remains open. The implications of reflux contributing to otologic and sinonasal disease processes has yet to be confirmed in adults. With the introduction of the currently described pH probe, a trend was seen for the lower pH near the eustachian tube orifice in patients with eustachian tube dysfunction. However, more patients are needed to increase the power of this study, and multiple institutes will need to confirm the findings. Although our study has not proven a cause and effect relationship between eustachian tube dysfunction and reflux, logic and deduction allows us to surmise that a patient whose eustachian tube orifice is being bathed in gastric acid will not respond to traditional eustachian tube dysfunction medications aimed at treating mucosal edema, primarily from an allergic standpoint alone. Our study shows that it is possible to detect reflux reaching the nasopharynx in patients with both GERD and ETD. In our own clinical experience, we have often noticed an improvement in eustachian tube dysfunction symptoms after treating with anti-reflux medications. This has especially been true in patients with a history of unilateral eustachian tube dysfunction and a tendency to sleep only on that side at night, or with a strong history of reflux that has been previously untreated. Further research will need to be done to validate these observations. Thank you.